Hi guys, it's your girl Nia. I said that I was going to do 2 videos, so this would be the second video, completely unrelated to Morgan's Wonderland. This is about a, I guess, injury slash medical personnel thing that I have been going through the last couple of weeks, almost about 1 to 2 months. I started having this pain randomly in the back of my leg, and from the feeling that I was having, and sorry, I totally have something in my eye, that I was having, I could kind of tell already that there was a tear of some sort. I could tell that I either tore my meniscus or something else just didn't feel right. And I've torn my meniscus. Sorry guys, I really do have something in my eye. I've torn my meniscus many times, and so I kind of am familiar with the feeling. So I started having this pain to where it would feel like it was stuck. I couldn't move my leg. I would be in excruciating pain. And it would, like, when I say stuck, it felt like it needed to pop, but it needed to pop like behind the knee on the outside. And so I started having this pain. I made an appointment first with my orthopedic, and that was a long rigmarole. I have basically, total side note, I have basically seen everybody in the orthopedic division at UT Medical in San Antonio. And hold on guys, I have to get this out of my eye. Okay, I'm back. Hopefully whatever that was is now out of my eye. But yeah, so my knee started feeling like I couldn't really move it. I couldn't straighten it or bend it all the way. It would feel like it was going to pop or snap, or like it hurt completely. So I made the appointment with the orthopedic, and after a couple of days, I went to see the orthopedic, and they take x-rays. And basically, they were like, well, you need a total knee replacement, which I've already known. I already knew that I needed a knee replacement, but because of my age, she said under her breath, I'm going to be turning 30 this year. But because of my age, I'm too young to be considered as a successful candidate for a knee replacement. And I was like, okay, well, I don't feel like it's a bone issue right now. I feel like it's something else. And he basically is like, well, I can refer you to like a sports medicine doctor. Maybe they can do like an MRI or something. And it was just, there was nothing that he can do to help me. And I even asked about injections or some other type of help, and he basically led me nowhere. So I knew that I had an appointment with my pain management doctor coming up like within the next week or two, and so I was like, well, maybe they might be able to help me. And I had kind of given up on, I was in a bad mental space when after I went to the doctor and was like, so I'm just supposed to live with this pain. He was like, maybe if you were 40 you would be a candidate for the knee replacement. So I even asked him, and I said this to him, so I basically have to live like this for 10 years is what you're saying. And there's no telling or helping or explaining why I'm having this pain. Like, yes, I deal with pain on a daily basis, and I've gotten used to that. I understand it. And yes, Crysvita has tremendously helped with my pain and discomfort. But when there's something new, I'm sure that to some of you it might be familiar. When you have pain, it's a new pain. It either one takes a while to adjust and get used to it, or two, like, you know that something's not right. You know that, okay, yeah, this isn't just like a little twinge. It isn't like a little sprain, or I overextended myself. There was something that I knew was wrong with my leg. And the pain had gotten so bad, I actually ended up going to the urgent care, and he told me, he's like, yeah, I'm pretty sure you have something torn in there. But because I went to like a small emergency room, they didn't have like a MRI machine or anything like that. And he actually wrapped it in a ACE bandage and put me in an immobilizer. But already being in already being in a wheelchair for the most part, having an immobilizer on your leg is not the most easy thing that you can probably have, because your leg's going to stick straight out. And yeah, that just, I knew that I was supposed to be in, like, wearing the immobilizer on his recommendation, but yeah, that wasn't going to work. Especially with the amount of pain that I was already having. If I were to like hit my leg just in the wheelchair, yeah, that was going to make it worse. So, and I can't wear my knee brace, because I have a custom knee brace, where the way that knee brace works is it's trying to get the pressure off the inner part of my knee. So it hits on the outer part of my knee where the pain is. And so I was pretty much SOL on any type of contraption helping me to stabilize or alleviate any of the pain. So it comes around to the time of my pain management appointment, and I'm explaining to her that I'm having this pain, I'm having this discomfort. Oh, well, let's back it up. I actually had an appointment with the PA, which the PA and I aren't on the best bases. And he basically was like, I was going to the pain management doctor originally because I had just had some injections in my back not too long ago. So they were seeing if it worked, which they didn't. I had if you're wanting to know, I had the nerve block, and then I had 2 of the nerve blocks in my lower spine area, and then I had the procedure where they actually burn the nerves. And it was basically a 50-50 chance on if it would work or not, and with what I'm feeling, I don't believe it worked. So he was more focused on the back, and even though I was like, can we like just get off the back for a minute, because the pain in my knee is more severe than what I'm feeling in my back right now. I can handle what's going on in my back temporarily if I can just get some help for my knee, because I cannot live like this. I cried. I was literally in tears, and all this PA did was give me some naproxen and said, well, let's check on it in a month and we'll see what happens. And I was like, okay. So when I scheduled the appointment, I said, no, I don't want to see the PA. I want to actually see my doctor. And so a month passes, and I finally am able to see my actual pain management doctor. And I tell her what's going on. And I was like, I know that you're probably going to ask about the back and everything, but I need help with my knee. It hurts. There's something wrong, and I know that there's something wrong. And so she took x-rays, and she looks at it, and she's like, well, I actually want to, because she was looking at my knee and she was feeling it, and she was like, okay, there's something going on in here, and I don't like the way that it looks and feels, so I needed to do an emergency ultrasound. That's the fastest thing that we can do right now to see if we can see anything going on in your knee. So the radiologist comes in, and he's doing the ultrasound on my knee, and as soon as he touches the wand to the back of my knee, he was like, oh yeah, I could see it. And of course he finished the rest of the knee, and he gets the doctor comes in. She's like, oh yeah, you definitely have a lateral meniscus tear. So but I need to get an MRI to see how damaged it is and what we can do. And I was like, okay, well, insurance is going to take forever to approve an MRI. I actually have the MRI coming up next week, so hopefully that there's something that can be done. Options that she said outside of surgery, because she didn't even bring up surgery, is there are 2 types of injections. One is, I believe, is called, I could be completely wrong, I believe it's called a PRP, and the other one is stem cell. The PRP basically takes some, give me a minute, some thing from my hip, can't even remember what it's called, some type of cartilage from my hip and spin it, and they inject it into my knee to kind of form a temporary kind of tendon cartilage type thing. Don't quote me on that. And then the stem cell is where they take stem cells from my spine, spin it up, and they put that in my knee. Both of which I was told are not covered by insurance. And they do both knees at the same time because I guess it makes sense to do both. Both of them are not covered by insurance. One of them costs $2,000 per knee, and the other one cost about $1,000 is what I was told. Whether that's right or wrong, I guess we'll see if that's what they suggest that I do. But the other problem that I have is that I may not even have enough cartilage in my hip to be able to supply the injections for the knee. In which case, I would need a donor that has the same stem cell match. So there's a whole other thing in which I'd have to go through if that is the option that I went down. And with these type of injections, she tells me that it isn't an immediate relief. It can take up to a year to feel any relief. So I could still be living with this pain and everything for up to a year to maybe get some relief. And it's not even a guarantee that there would be relief from these injections. So that's where I'm at. If anyone has had a similar experience with a lateral meniscus tear, and what they did to help you, please let me know. Maybe I can ask the doctor about it, see what can be done. If you have any questions, concerns, statements, please feel free to do so. And you can reach out to me on my other social media platforms. I appreciate everybody for watching these videos, and I hope that I'm helping in some way by sharing these. And I will try to do more. At least I'm going to try to do once a month. I am going to try to do a video with my sister who also has XLH. I'm going to try to do that relatively soon. She's always so busy. But yeah, thanks for watching. Bye.